Thank you. See no more witnesses in support. Witnesses in opposition or others in opposition?
My name is Bianca Lara. I'm a daycare provider.
Please proceed. We have a motion. We have a second.
Thank you. My name is Bianca Lara. I'm a daycare provider. On behalf of my colleagues statewide, I'm here to voice my concerns on SB 792. Daycare providers are often women in their childbearing years with their own young children in addition to those they care for. Most make very little, working long hours, often on evenings and weekends. Child care providers are a precious resource. With amendments, SB 792 can protect this resource and our children. 792 initially included the full adult CDC schedule of vaccines, plus any of the 200-plus vaccines in development. The bill was amended to now only include measles, pertussis, and flu to make it more accessible and less costly. However, since no single antigen vaccines exist on the U.S. market, we would be subject to 7 vaccines required for employment in this Trojan horse bill, which includes the 3 most controversial vaccines with the most compensation for injuries. There's never been an occupation in the U.S. that mandates vaccines without an exemption as a requirement for employment, whose violation is also a crime. The cost to comply is estimated at $150, while other adult vaccine mandates are covered by the employer. In 792, the financial burden, adverse reactions, and any damage to herself or children are carried solely by the child care provider herself. 792 has the California legislature writing a prescription for name-brand pharmaceutical drugs that have not been tested individually or collectively for their effect on pregnancy or fertility. This fact is clearly stated in the current vaccine insert you've just been given. The MMR cocktail, controversial for some, contains a more aggressive contraindication in its insert than what is on the CDC website for the very same vaccine. The insert states that MMR is contraindicated for women about to become pregnant, are pregnant, or are lactating. The Tdap and flu inserts also state their effects on pregnancy and lactation are unknown and recommend them in pregnancy only if clearly needed. However, the CDC recommends those vaccines for pregnancy. If the goal of this bill is to protect infants with this mandate, then the state must do its due diligence to ensure that it also protects the developing infants and those that are yet to be conceived. We respectfully request 3 amendments to this bill. 1, the addition of the healthcare worker exemption language to the bill to be utilized by the very few that will need a low-cost, easily accessible exemption for vaccines beyond the flu shot. 2, for the state to reimburse any out-of-pocket expenses incurred by the provider to meet this mandate. And 3, for SB 792 to include a mechanism for a full and thorough process of informed consent on the contraindications, disparity between the vaccine manufacturer suggestions versus the CDC recommendations, and the lack of testing for mutagenic and carcinogenic effects on pregnancy, fertility, and lactation. This piece is essential as pharmaceutical companies have no liability for damage or injury that may befall the caregiver or her developing child.
You're over your 3 minutes. You can continue, but you'll be taking time away from your colleague.
Within these vaccine mandates, the benefits are quite concrete. However, the disadvantages are more abstract. Before California becomes the most aggressive state in the U.S. with respect to vaccine mandates, we ask you to acknowledge that vaccine medicine is not yet an art form and contains hazards for some. We respectfully request that you oppose this bill without the amendments.
Thank you. Next witness in opposition.
My name is Dr. Tara Zanfleet. I'm an MD and physician in San Diego. As a pediatrician, I share your desire to protect the children from disease. As an internist, however, I feel that the bill goes too far in eliminating most of the exemptions. Medical exemptions do not cover many legitimate objections to these vaccines. For example, the MMR is made using aborted fetal tissue cell lines, and many will refuse that. The MMR and Tdap both contain bovine serum and other additives, which are objectionable to many. Medical exemptions do not cover family members of those who have died or were injured by vaccines. There is no exemption for those who are about to become pregnant. The MMR is contraindicated during pregnancy, but also during preconception and lactation. Many child workers are of childbearing age, and pregnancies are difficult to predict at best. The Tdap also has about a 17% spontaneous abortion rate when given in pregnancy, according to a 2012 study. If doctors are following the guidelines and giving it in their third trimester, it compares to a 0.3% baseline rate. That's a huge risk. We ask that you broaden the exemptions allowed in this bill. In addition, medical exemptions will be difficult to obtain for this population especially. Access to medical care will be required. They are not well paid. They will likely qualify for Medi-Cal. After a 3 to 4 month wait while the paperwork is being processed, they will then have a 2-month wait for an appointment with their assigned primary care provider. So a worker with a legitimate medical condition will still be jobless 6 months later through no fault of their own. Vaccines are medical procedures, and as such, they require informed consent. It exists so doctors, government, and pharmaceutical companies cannot subject people to medical interventions against their will. The crux of the issue is the right to refuse. Without it, informed consent is violated. In this bill, pertussis and measles are mandated without options to decline. But pertussis and measles don't exist in the U.S. as individual vaccines. They are in combination with tetanus, diphtheria, mumps, rubella, so the risk is compounded to include the full 7 vaccines that the bill would require. How high is the risk?
You're at time. Please wrap up.
Okay. According to the Vaccine Injury Compensation Fund records, they are the 3 highest paid compensation. In this, the bill singles out daycare workers. Pediatricians can decline the vaccines. Firefighters, teachers, and even Disneyland employees can refuse the vaccines. For the first time outside of the military, we are opening the door to medical procedures being a condition of employment, and it is targeting a group who can least afford it and has the least protection.
Thank you. Thank you. Additional witnesses in opposition.
Terry Rourke, native Californian, surviving parent of vaccine-injured child, on behalf of the California Coalition for Vaccine Choice, in alliance with the National Vaccine Information Center, we strongly oppose any vaccine mandates without clear personal belief exemptions. Thank you.
Thank you. Additional witnesses?
My name is Jessica Hall. I'm a credentialed teacher in the state of California. I am opposing this bill. I have an autoimmune disease for which I cannot receive a medical exemption. My fear is that this will spread to teachers next, and I will no longer have a teaching career. There are a lot of conditions for which you cannot get a medical exemption. It is extremely narrow. This would not be healthy for me and for a lot of other people. Please vote no.
Thank you. And just as a reminder, after the 2 substantive witnesses on each side, we're having witnesses only state their name and organization and their position on the measure, not providing substantive testimony. Questions or comments from members of the committee? Seeing none. Assemblymember Thurman. Vice Chair Mainshine.
It's very kind of you, Mr. Thurman. Thank you. Just briefly, to the author, I'd ask, as this, assuming this were to move forward out of this committee, if you'd continue to work with the opponents and address the issues raised in the proposed amendments before it got to the floor. I assume that's something you'd be willing to do?
Yes, I will. We have been working with them. We will continue to be working with them. That's never been an issue.
Okay. Thank you very much.
Thank you. I appreciate that, Mr. Mason.
Assemblymember Thurman, then Assemblymember Patterson.
Thank you, Mr. Chair. And I just wanted to give the author and his witnesses, if they wanted to, a chance to address the concerns about women who are pregnant or likely to be pregnant. I saw the author was sort of gesturing during that he might want an opportunity to address that. So
definitely not in agreement with that. But you know what? We have a doctor here. I would love for him to answer that.
Thank you, Mr.
Doctor,
Chair.
please.
Senator, basically, again, the bill very clearly indicates that the medical exemption is there, and in fact, measles vaccine is not to be given to pregnant women or women who are becoming pregnant. That's very clear. Again, on the issue of other contraindications, again, this is between the doctor and the person who's being vaccinated. There's also informed consent. There are vaccine information sheets that provide all information and pluses and minuses of vaccination so that a person is making an informed consent as well.
Maybe the health office can answer that one issue where the vaccines are made from aborted fetuses or things of that nature. The health office, have you? I know that's inaccurate, and that's been
Oh, well, that's a concern that has not yet come up on this bill. So we need to look into that.
I didn't have any additional questions, Mr. Chair. I just wanted it to be stated that there were these concerns about putting, employees who are pregnant at risk, and I believe that they were pretty clearly stated that, at least in the case of measles, to not be administered, and that as it relates to other vaccinations, it's a conversation between the individual and their physician.
That's correct.
Thank you.
If I just might. I'm sorry, if I just might follow up on that, too, because of the other two vaccines we've talked about. Again, the Centers for Disease Control and public health officials around the country actually actively recommend for pregnant women the pertussis-containing vaccine and influenza-containing vaccine because of the fact for influenza disease is much more serious disease in pregnant women. This will protect their lives. And secondly, for pertussis, not only does that antibody to the vaccine go across to the infant, so they're protected even from birth, but also then they provide a cocoon around that infant of a protected, immunized individual. Thank you.
Assemblymember Patterson.
Thank you. Just connecting with Vice Chair Mainshine's comment. You are continuing to work with the opposition with respect to the expressions of their amendments.
We've been working with them since we were in the other house. We've actually downscaled it to where we're at right now because of working with them. We're going to reach a point where they're going to want certain exemptions that we're going to agree to disagree on. That's been the case with the other vaccine bill. We're going to get to a point where we're at the point that we just can't agree, and we can't. We just agree to disagree. At this point, we're as we're hearing more issues that come up, we look into them, we validate them or not, and we just start and then we take amendments into our bill to make sure that we try to address some of the concerns. But sometimes the concerns change a little bit, or they bring other ones, and we have to keep looking into those, and that's okay. But yes, we will continue to be working with them.
To the opponents, are you satisfied with the level of cooperation that the author has demonstrated thus far?
No.
Thank you.
Additional comments or questions from members? Assemblymember Burke.
I want to make sure I'm clear. So there is or there is not or there will be or you're looking at a exemption for women who are trying to get pregnant, women who are pregnant, and women who are lactating. As a woman, I have to ask that whole complete question. I just want to get like a simple answer.
Okay, this bill, if you're pregnant or about to get pregnant or through your doctor, this bill will not apply until if
you are a pregnant woman trying to get pregnant or lactating, you go to your doctor to get a medical exemption, and then you do not have to get the vaccines. Right. That's the way that you've accommodated for that issue.
Yes, especially with the HIPAA requirements, yes.
Okay, thank you.
Any additional questions or comments from members of the committee? Seeing none, we have a motion. We have a second. Senator Mendoza, would you like to close?
Members, it's been a long day. I appreciate your indulgence, and I respectfully ask for your aye vote.
Thank you, Mr. Senator. We have a motion. It's due pass as amended to Human Services Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Aye. Burke, aye. Chavez? Chu? Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Aye. Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Aye. Rodriguez, aye. McCarty? Aye. McCarty, aye. Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? No. Waldron, no. Wood? Aye. Wood, aye.
11-1.
The bill passes with a vote of 11-1.
Thank you, Mr. Chair. Thank you, members.
Thank you, Mr. Senator. I see Dr. Pan. We will go to item number 7, SB 610. Dr. Pan.
Okay.
Dr. Pan, whenever you're ready.
Okay, thank you, Mr. Chair and members. I am not here to talk about vaccines. I'm here to present SB 610, which requires the Department of Healthcare Services to finalize a new reimbursement rate and complete annual reconciliations for federally qualified health centers or rural health centers within specified timelines. And I just first want to thank the committee and the committee staff for working with me, and want to first say that I accept the committee amendments to extend the department's timelines to finalize the reimbursement rate to 1 year instead of 90 days in the current bill, since they already follow a 1 year timeline for Medi-Cal managed care plans. In addition, I believe that there was a proposal that a second suggested amendment of 24 months to complete the reconciliation process, but I understand that we have an agreement that we'd like to suggest a middle ground of 18-month timeline for the Department of Healthcare Services to complete the reconciliation. That is, of course, if you add the two up, that we're still talking about 2.5 years while clinics are waiting to get paid money that they have already been owed. So again, I really appreciate the committee working with us on that. In addition, we are also aware of chaptering out conflicts with another bill being authored by Assemblymember Wood, and would like to mention that is another CPCA-sponsored bill that we'll be working with the sponsors and the author's office to rectify those chaptering out conflicts. As I mentioned, SB 610 does address the reimbursement rates and conciliations for clinics. And unfortunately, right now, there are no timelines. There are no timelines that requires the Department of Healthcare Services to finalize reimbursement rates or annual reconciliations. And the result of that has been that the Department of Healthcare Services, our state, has taken approximately 5 years to finalize a new rate, and approximately 3 years, thank you, to reconcile. So state owes clinics $50 million. I think we need to address that. This is it's jeopardizing our clinics, and I appreciate the work of the chair and the committee, and respectfully ask for an aye vote, and I have witnesses in support.
Thank you, Dr. Pan. We had a motion and a second. First witness in support.
Sure. Chair Member Sean South with the California Primary Care Association. I want to thank Dr. Pan for his leadership, and I want to thank the chair and the committee for both our dialogue and the effort around amendments, and we thank you for that work. I have Andy Patterson with me to answer any technical questions.
Andy Patterson, California Primary Care Association, here for questions. Thank you.
Thank you. Additional witnesses in support?
Kelly Brooks on behalf of the Association of California Healthcare Districts. The 78 healthcare districts across the state provide a variety of hospital, clinic, and public health services, and we're here in support.
Thank you. Witnesses in opposition? Seeing none, comments or questions from committee members? Assemblymember Ridley Thomas.
Yes, Dr. Senator, thank you for bringing the bill forward. All of us hear these complaints from our community clinics about timeliness with respect to the department. I was concerned prior to your working with the committee on amendments that we were doing a little bit too much with the timeline, but this sounds reasonable. We hope that it will improve the relationship with the state and our local providers, and we also hope that the governor will actually sign this, because we really do need to improve this system.
Yes. Thank you.
Thank you, Assemblymember. Additional comments or questions from members of the committee? Seeing none, Dr. Pan, would you like to close?
I respectfully ask for an aye vote. Thank you.
Thank you, Dr. Pan. We have a motion. We have a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta.
Aye.
Bonta, aye. Mainshine. Aye. Mainshine, aye. Bonilla. Burke. Burke, aye. Chavez. Chu. Gomez. Gonzalez. Hernandez. Lackey. Lackey, aye. Nazarian. Patterson. Patterson, aye. Ridley Thomas. Aye. Ridley Thomas, aye. Rodriguez. Aye. Rodriguez, aye. McCarty. Steinnorth. Aye. Steinnorth, aye. Thurmond. Aye. Thurmond, aye. Waldron. Waldron, aye. Wood. Wood, aye. Hernandez. Hernandez, aye.
The bill passes with a vote of 12-0. Thank you, Dr. Pan.
Thank you. Thanks very much. Thank you, Member.
Okay, I see Senator Allen. We'll go to item number 8, SB 613. Senator Allen. Welcome, Senator Allen, whenever you're ready.
Members, I too am not presenting about vaccines. I'm actually presenting SB 613, which my fellow Jew, Tony Thurmond, will recognize as a special number, the number of commandments in the of good deeds, mitzvot, in the Torah. So it's a very special number for us, and it's a bill that has to do with updating the physician's guidelines for Alzheimer's care. So I don't know how to tie those together, but I just made a feeble attempt. So there we are. Yeah. So some of you heard during our last discussion, and we've talked a number of times about how elected officials are oftentimes inspired to do their work from family experiences. And some of you know that my father has polio, but this legislation actually is inspired by my grandfather who had Alzheimer's. We were a healthy family, but certainly I've experienced the scourge of that terrible disease in my family. So upon arriving at this office, I reached out to the Senate Select Committee on Aging and Long-Term Care, and they'd actually been looking at this legislation for some time, along with the folks from the Alzheimer's community. And it seeks to include creating management care guidelines for Alzheimer's and dementia. And so I appreciated this guidance, the work many others have done in this room and across the state, and I'm honored to help champion efforts to address this terrible disease. Okay, well, there we are. Should we just...
Excellent. We have a motion. We have a second.
Okay. Well, I would respectfully ask for an aye vote.
Thank you, Senator Allen. First, witness in support.
Good afternoon. I'm Susan DeMorris with the Alzheimer's Association, and I have a lot to say, but I will respectfully ask for your aye vote. Thank you.
Thank you. Additional witnesses in support?
Rebecca Gonzalez, National Association of Social Workers, California Chapter, in support.
Thank you. See no additional witnesses in support. Witnesses in opposition? Seeing none. Questions or comments from members of the committee?
Senator, this bill sunsets in 2018. Would you anticipate continuing work being an informal process, or with external stakeholders maybe convening their own work group? Is there any thought about that?
Yeah,
because the issue doesn't go away.
It doesn't go away. It doesn't go away.
Broader, frankly.
It doesn't go away. So I think the assumption would be that the work would continue with our oversight from the legislature, and it's a way of just underscoring the importance of the issue in the context of some of the changes in the ACA and new federal guidelines.
And toward the extent that you are deeply committed to continue with these issues, this isn't necessarily a suggestion for the bill, but because of the population changes and the lack, it may be something for the Institute of Regenerative Medicine or OSHPOD and the lack to really kind of have a permanent dementia memory loss activity.
Yes.
Because that's our state's own National Institute of Health. And it seems to me that because of the growing population changes, for example, in your district at Cedars, Keith Black, a prominent neurologist and neurosurgeon, is leading on dementia and retinal screening and how you can have early markers and improve health outcomes related to it. Things like that, I think, from a state perspective, merit public-private partnership, whether it be funding and the like. Maybe this work group is a part of those dynamics, and it'll help reduce healthcare costs long term.
Well, absolutely, and I'd love to work with you on that. Along those lines, I think we're spending about $2.2 billion every year on treatment, when we're only spending about $500 million on research over time. So there's a huge savings opportunity here if we're able to get our heads around finding a cure, and I think the Center for Regenerative Medicine could potentially hold a lot of promise.
Thank you for bringing the bill forward. It's already been moved and seconded, but if you really try to make it a permanent group or figure out how you do it external so we don't have to run legislation and fiscal costs and all that, maybe there's a way to think of it with some of our appendages or our special fund supported programs that have a significant interest in helping to reduce or mitigate as best we can the effects of memory loss on the individual regions in society. So that's just an idea. That's
Sure.
all.
No, and I'd love to work with you as a member. I'm sure that my sponsors and colleagues here would love to work with you on that. Yeah.
Thank you, Assembly Member. Any other questions or comments from members of the committee? I had a quick one. Senator Allen, could you inform the members of the committee how the LA Galaxy did in the California Classico against my San Jose Earthquakes this past weekend?
The most important match, I think, is actually the U.S. Cup, which is coming up next week. That is a single elimination tournament. But I do believe that the Galaxy did they? I don't even know. Did they? I was away.
I'll clarify. They lost 3-1 to my San Jose Earthquakes.
The point is not well taken, Mr. Chairman. Not well taken.
I acknowledge I'm out of order there. I apologize, Senator Allen.
That's okay, Mr. Chair, as long as you support this legislation.
Thank you, Senator Allen. Would you like to close?
I respectfully ask for an aye vote.
Take that as your close. Thank you. We have a motion. We have a second. Do pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chu? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. McCarty? McCarty, aye. Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye.
Thank you, members. Thank you so much.
14-0.
The bill passes 14-0. Thank you, Senator Allen. Okay, we have one more bill, and our author, Senator Bell, is currently tied up in another committee presenting. So, okay, we can have Assemblymember Ridley Thomas present on behalf of Senator Bell.
I'll move the bill, Mr. Chair.
All right, you're excused from presenting. No, go ahead. Please present. I know you've been waiting for this moment. Assemblymember Ridley Thomas.
Mr. Chair, members, I am a co-author?
No, Rodriguez.
Oh, Rodriguez. You want to do it? Yeah. No.
Doing a fine job.
Well, this is SB 326, which augments Senator Bell's AB 2173 of 2010, and it has to do with the Emergency Medical Air Transportation Act, which, because of Mr. Rodriguez's experience, he could probably speak more to, but it places a penalty on the an additional fee on vehicle code violations, save parking violations, and helps fund a portion of the Medi-Cal fee related to air transportation. I'll note that on page 4 of the bill, lines 3 and 5, there's a redundant language issue that needs to be addressed, Mr. Chair. The language is submit any state plan amendments or waiver requirements that may be necessary to implement this section. So it's redundant. I think that's an error, unless it was intentional.
Are we amending the bill in committee?
No, we're not amending the bill in committee. We're simply making note of it.
I'm on it.
And I'm sure that that'll be addressed in subsequent committees. I respectfully ask that for an aye vote. We have witnesses here to attest to the merits of the bill.
Witnesses in support.
Catherine Oskin Scott, I'm going to defer our testimony to folks, the hospital associations in support. But.
Hi, my name is Bill Bryant. I represent the air medical providers in the state. And all this bill does is continue a program that is currently in place, has been in place for 5 years, and works. It places a $4 additional penalty on moving violations, perfect nexus with what we do, the people who cause the accidents to the people that have moving violations. The program works. We have implemented it with the department. They've gotten CMS approval from it, and they draw down federal matching dollars along with us. So we ask for your aye vote. Thank you.
Thank you. Additional witnesses in support.
I'm Len Baumstrom. I'm the president and CEO of CalSTAR, California Shock Trauma Air Rescue. I'm here representing the air medical providers here in California, and I'm asking for your aye vote.
Thank you, sir. Additional witnesses in support.
Good afternoon. Chris Hall with PHI Air Medical asking for your support.
Aaron Cox, PHI Air Medical asking for your support.
Bill Baker with Air Methods Mercy Air asking for your support.
Troy Jones with PHIR Medical asking for your support.
Andrew Holcomb with PHIR Medical asking for your support.
Will Martin with Mercy Air and Air Methods asking for your support.
Eric Hodson, flight nurse out of Sonora for PHI, asking for your support.
Hi, I'm Lori Hines, clinical nurse educator for CalStar Air Ambulance, and my base is at McClellan, asking for your support for Senate Bill 326. Thank you.
Hi, good afternoon. Mark Vincenzini, Chief Financial Officer at CalStar, asking for your support.
Thank you. Any witnesses in opposition? Seeing none, any questions or comments from members of the committee? Assemblymember Rodriguez.
I want to thank the author for bringing this bill forward, and I'd like to be included as a co-author as well. And I want to thank the fine men and women of the air transport services. They are a really highly skilled group of individuals that I've seen firsthand on experiences out on highways and things that they do to provide the really good emergency medical care to the folks in the state of California. Thank you.
Thank you, Assemblymember. Additional questions or comments from members? Seeing none, Assemblymember Ridley Thomas, would you like to close?
Respectfully ask for an aye vote on behalf of Senator Bill for this rather important program that provides critical access to all parts of California. Thank you for the committee's consideration.
Thank you, Assemblymember. We can entertain a motion. Okay, we have a motion. We have a second. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chu? Gomez? Aye. Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. McCarty? McCarty, aye. Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye.
Thank you, Chair.
15-0.
The bill passes 15-0. Thank you, Assemblymember Ridley Thomas. We're going to do add-ons. We're going to start from the top. Number one. What's that? Okay. Okay. Nothing's on call. Okay. We're going to start with item number 1, SB 149, Senator Stone. All of them. Okay. We're on item number 1, SB 149, Senator Stone. Madam Secretary, please call the roll for add-ons.
Bonilla, Chavez, Gomez, Gomez, aye. Gonzalez, Gonzalez, aye. Hernandez, Hernandez, aye. Nazarian, Ridley Thomas, Ridley Thomas, aye. 15-0.
That bill is at 15-0. Next, we'll go to the consent calendar. Add-ons on the consent calendar. 2 items on that calendar. Madam Secretary, please call the roll.
Burke, Chavez, Gomez, Gomez, aye. Gonzalez, Gonzalez, aye. Hernandez, Hernandez, aye. Nazarian, Ridley Thomas, Ridley Thomas, aye. 15-0.
That bill consent calendar is at 15-0. Moving to item number 4, SB 315, Senator Monning. Madam Secretary, please call the roll for add-ons.
Bonilla, Chavez, Gomez, Gomez, aye. Gonzalez, Gonzalez, aye. Hernandez, Hernandez, aye. Nazarian, Ridley Thomas, Ridley Thomas, aye. 15-0.
That bill is at 15-0. Moving to item number 5, SB 326, Senator Bell. Madam Secretary, please call the roll for add-ons.
Bonilla, Chavez, Chu, Chu, aye. Nazarian, Nazarian, aye. 17-0.
That bill's at 17-0. Moving to item number 6, SB 388, Senator Mitchell. Madam Secretary, please call the roll for add-ons.
Chavez, Gomez, Gomez, aye. Gonzalez, Gonzalez, aye. Hernandez, Hernandez, aye. Nazarian, Nazarian, aye. Ridley Thomas, Ridley Thomas, aye. 19-0.
That bill's at 19-0. Moving to item number 7, SB 610, Dr. Pan. Madam Secretary, please call the roll for add-ons.
Bonilla, Chavez. Chu. Oh, I'm sorry. The last one was 18-0. Yes. Mr. Chavez is not here. Bonilla. Chavez. Chu. Chu, aye. Gomez.
Aye.
Gomez, aye. Gonzalez. Aye. Gonzalez, aye. Nazarian. Aye. Nazarian, aye. McCarty. Aye. McCarty, aye. 17-0.
SB 610 is at a vote of 17-0, and clarification and an amendment SB 388 was a vote of 18-0. Moving to item number 8, SB 613, Senator Allen. Madam Secretary, please call the roll for add-ons.
Bonilla. Chavez. Chu. Aye. Chu, aye. Gomez.
Aye.
Gomez, aye. Nazarian.
Aye.
Nazarian, aye. 17-0.
That bill is at 17-0. Moving to our last item, item number 9, SB 792, Senator Mendoza. Madam Secretary, please call the roll for add-ons.
Bonilla. Chavez. Chu. Chu, aye. Gomez.
Aye.
Gomez, aye. Gonzalez. Aye. Gonzalez, aye. Hernandez. Hernandez, aye. Nazarian.
Aye.
Nazarian, aye. 16-1.
That bill is at 16-1.